Hi, my name is Todd Mobbs. I'd like to tell you about one man's healthcare experience. My father, Lee Mobbs. He suffered a stroke and a hemorrhage during a wingspan stenting procedure performed by Dr. George Purpart at Glendale Adventist Medical Center in Glendale, California. He was put into a semi-comatose arousable state where his prognosis was a wait and see to allow a heal, with a somewhat good outcome if everything healed properly. He was sent to a number of different facilities, one which he ended up at Kindred Hospital, Los Angeles, where he developed numerous large stage 4 bed sores. The facility was very dirty and appeared to be understaffed. We complained about his level of care. The nurses became hostile and retaliative, claiming he had numerous terminal illnesses. We attempted to have him relocated. We contacted the Insurance HMO, Scan Health Plan, Regal Medical Group, West Valley. They did not assist us. They ignored our phone calls, faxes, and letters. He was eventually moved from Kindred. He left Kindred in far worse condition than he arrived. He was downgraded to a nursing home, Hancock Park Rehabilitation in Hancock Park, California. When he first arrived, he was very underweight and appeared to be in very poor health. He quickly gained back the weight, started responding, becoming uncomatose, answering questions accordingly, moving all 4 limbs. The facility talked about doing rehabilitation. They did not, and we questioned them, and they claimed that they were not getting the financial cooperation from the insurance. Scan Health Plan, Regal Medical Group, West Valley. After this point, they began slacking off on his level of care. He became sick, had to be transferred to a hospital where he had numerous infections and he was septic. He was stabilized and sent back to the nursing home, Hancock Park. They continued not to do proper care for him. He started looking in poor health every day. Eventually, he looked like he was just about to die. We complained to the facility, threatening to report them to everybody. A little over an hour after we left, he was admitted to the hospital. He had numerous infections, kidney failure, with other organs following suit. And at this time we were told that he now had diabetes. He was stabilized and sent to another nursing home, Topanga Terrace Convalescent Center in Canoga Park, California. At first, he started doing better, responding, not as well as the first time. The facility avoided the subject of rehabilitation. Eventually, they did tell us that they were not getting cooperation from the insurance. They transferred him to the hospital, where the hospital informed us that he was not properly being cared for at the nursing home. He was stabilized and sent back to the nursing home, Topanga Terrace. They continued not to do proper care for him. We complained to the facility to no resolve. At one point, the Department of Health came in and cited them. The nurses got hostile and retaliative, taking far worse care of him. I contacted the Department of Health in Los Angeles. I spoke to Supervisor Jeffrey Stanley, informed them that the facility was retaliating after their first visit. He refused to go out there and investigate, act like it wasn't happening. He did not want to hear it. These problems continued to escalate. This was about the time of my parents' 50th anniversary. Approximately 3 days after the 50th anniversary, my mother just died. No warning, she just died, 67 years old. These problems continued at the nursing home. Eventually, he had to be rushed to the hospital, where they informed us that the wounds didn't appear to be properly cleaned and taken care of. He had numerous infections. He was stabilized and transferred to a number of different facilities. He passed away at Promise Hospital in Paramount, California, 71 years old. We've had a number of problems, issues. One of which was Social Security would not give my mother my father's Social Security checks to pay her bills during his hospitalization because she did not have proper ID. She was not able to obtain ID because of the new 9/11 laws because she did not have ID for a certain amount of time. After she passed away, they made me his responsible payee, but said the checks can only be used for his health care expenses. They contacted me for a overpayment from time after he passed away. I've informed them that I did not cash the checks and even offered to send them back. They are very unreasonable to deal with. Thing on my credit. She should have been given the money during the time of his living so she could pay her bills, or it should have been refunded to the ones who paid her bills for her. Another of which is the Los Angeles Department of Public Health that made complaints against Kindred that was not investigated for approximately a year. Advocate found out that they did investigate approximately 9 months after they investigated, but they did not inform me. They only investigated the bed sores. They are very reluctant to accept my written complaint and photos. They pretty much refused. I have made complaints against Hancock Park and Topanga, another one against Topanga Terrace, which, far as my knowledge, has never been investigated. I've spoken to Supervisor Eric Stone of the Department of Health approximately a dozen times. He was in a number of great facilities, for one of which was, for example, Glendale Aventus, the place that caused the stroke and hemorrhage. Even though that happened there, they were perfectly capable and even specialized in such treatment. Even the doctor stated that. But the insurance scam preferred to put him in these other facilities. I am making a series of videos detailing his healthcare experience. Thank you.